Hey future doctors, welcome back to our channel Teddy Gets You. Today in this video, we are going to discuss about an important topic in ophthalmology, that is fungal keratitis, which is also called as mycotic keratitis. Okay, so the name itself is saying there is inflammation to the cornea. Kerata means cornea. The inflammation to cornea is due to fungus. So, the name itself is saying fungal infection of the cornea, which leads to corneal ulceration and potential vision loss, because in ulceration there are 4 stages. First one is eye initial, progressive, regressive and scar. Okay, can be remembered by IPRS. In initial you will see there is saucer like appearance of the epithelium, and in progression you will see a depression, and in regression you will see the smooth boundaries of the ulcer, and in the last stage you will see there is scar formation. Because of this scar formation there will be potential vision loss. Okay, so this is the pathogenesis that you must know here. The etiology or the common fungi are, first one is fusarium, which is filamentous fungi, aspergillus, which is also a filamental fungi, candida, yeast like fungi, mucor, which is mostly seen in immunocompromised patients. Okay, here you will see aspergillus, which is most common. For example, you will get a question like this: there is trauma in vegetative fields. A farmer was apparently alright and suddenly underwent a trauma in the vegetative field. It leads to corneal disruption or damage to the cornea. So it is definitely fungal keratitis. The important point in the question that you must remember is trauma plus vegetation. Okay, and the pathogenesis is fungal enters or fungi enters through corneal injury. So trauma with vegetative matter or contact lenses. Then the fungus slowly grows and penetrates deeply, which causes inflammation, necrosis, hypophyon. Hypophyon is nothing but the pus accumulated in the anterior chamber, like below anterior chamber. If this is cornea, here you will see pus accumulation. This pus accumulation is also divided into two types. First one is depending on the motility, whether it is mobile or immobile. In bacterial keratitis it is mobile, whereas in fungal keratitis it may be mobile or it may not be mobile. And the clinical features are red eye pain, blur, redness, photophobia, epiphora, dull pain, elevated ulcer with feathery margins. Here there is an important point. The ulcer is feathery shape and you will see a satellite lesion here, which is surrounded by an immune ring. This immune ring is very important, which is also called as endothelial plaque or something like feathery immune ring. I'm not sure about it. If you know it, please let me know in the comment section. So redness, epiphora, dull pain, elevated ulcers with feathery margins and yellowish white stromal infiltrates, immune ring, satellite region and hypophyon, and if it is deep it also leads to perforation risk. Okay, so these are the important points that you must remember here. And what is the diagnosis, or how are you going to diagnose this? First, corneal scraping to know what kind of fungi is affecting the eye. So gram staining to exudate bacteria, and you will do culture and microscopy. So these are the general diagnosis that you must follow in your lab. Next one, what are the medicine or treatment that you are going to give to your patient? First one, you will give antifungal drugs like natamycin, voriconazole, and you can also give amphotericin B. So these two are important, natamycin and amphotericin B. And the complications are corneal perforation, endophthalmitis. In endophthalmitis, panophthalmitis. If the inflammation in the deep structures of the eye, it is called as endophthalmitis. If the inflammation present in complete eye, it is called as panophthalmitis. So how are you going to prevent this? Prevention is by avoiding trauma, proper contact lens, hygiene, and early diagnosis and treatment for corneal infections. These are the important topics that you must remember regarding fungal keratitis. Hope this video helpful. Consider subscribing to the channel Teddy Gets You for more interesting videos like this. This is Harshita signing off. Thank you so much.